And last but not least, I think it's a given, but I work at a pharmacy, and I also get by this insight. I always imagine it's my sister, my friend, my mother in front of me, and what would you tell them or give them as advice?
Be together, we can get this right.
Back from Phyllodes patients. First is the optimistic diagnosis at biopsy. Doctors talk about it being something benign, never mentioning Phyllodes, never mentioning tumor. It's not uncommon that after surgical removal, pathology comes back different from the biopsy, which can be a huge blow for a patient. Underestimating the mental impact, especially when the lump is very visible or when the surgery has left a dent in the breast, let alone a mastectomy, it may have a huge impact in the way a female patient perceives herself. Then the little information given by specialists, since Phyllodes is relatively rare, it's important for the patient to get information, and we would like to encourage the patient to get information and get referred to patient groups on and offline. And also, for instance, Dr. Laura Rosenberger, who was mentioned before from the US, has joined the closed Facebook group to spread word about her study, finding participants, but also learning from the patients' comments in the group. Onto radiation. If radiation is performed, we hear that radiation is often presented as a mild treatment, where mainly the pros are mentioned and only a little fatigue as a side effect, as a con maybe. For me, I only heard of radiated tissue being difficult to do surgery on after radiation. I heard that only years after my radiation had finished. And it was an unpleasant surprise. And it's good that there's more emphasis now on the long-term effects of radiation, I think. Then the last two topics, the variety in treatments and follow-up, is very confusing for patients in similar circumstances. Like Frederike said, from one clinic to the next, the regimen and the follow-up can vary tremendously. And we believe a standard protocol or guideline would be very helpful, not just to check all the boxes, but as a frame to go by. And in individual cases, there should be room to add or leave some options out, depending on the personal circumstances. And last but not least, I think it's a given, but I work at a pharmacy, and I also get by this insight. I always imagine it's my sister, my friend, my mother in front of me, and what would you tell them or give them as advice? This concludes my presentation. Thank you.
Thank you very much, Marloes. That's a very impressive presentation.